Hello people, in this video we want to look at this topic syncope. So basically syncope refers to sudden loss of consciousness. So you will suddenly lose consciousness. You will recover also quite fast only. This is syncope. You are having a fainting episode kind of a thing. So this is sudden loss of consciousness, then you recover. That is syncope. This will happen because of reduced cerebral perfusion. Okay. So now why is there reduced cerebral perfusion? So where is the cerebrum? Here is the cerebrum. And there is less perfusion to it. Whose job is it to perfuse the brain? The heart, it should pump, right? And for whatever reason, if the blood pressure is low, right, because there is some vasodilation or something. So if there is hypotension, what will happen if there is hypotension? That means low BP. If there is hypotension, what will happen? Low BP, the cerebral perfusion will get affected and that person can have syncopal attacks. Okay. So look at the causes here. Mechanical cardiac dysfunction, that is cardiac syncope, arrhythmia. Then neurocardiogenic syncope, it is also called as vasovagal syncope or reflex syncope. So we are more familiar with the vasovagal. So here they are blaming the nerve and the heart. Neurocardiogenic syncope, okay, that is again because of hypotension. Then postural hypotension, that is because of vasodilation. Peripherally vasodilation will occur. So because vasodilation will occur, what will happen? Instead of vasoconstriction, vasodilation will occur in these people. So what will happen? Hypotension and they will faint. Actually, when you stand up, if you are normal, if you stand up, there will be peripheral vasoconstriction. So your blood pressure will increase and you will be fine. You will be able to. But people who suddenly stand up, what will happen? And they are not able to create this constriction. There will be dilation for them. And that time there will be low blood pressure, hypotension, and they will go into syncopal attacks. Okay. What is pre-syncope? Pre-syncope means the individual thinks that he will black out, lightheadedness. He will know he'll black out kind of a feel. Okay. So this is syncope. So you have understood the causes, right, of syncope? Cardiac syncope, neurocardiogenic syncope, and the other thing, what did they say? Some postural hypotension. Here they are actually comparing these syncopes. These are the syncopes that we are concerned about, right? These syncopes, they're comparing with seizures. Anyways, remember in syncope, there will be recovery. Okay. So that's what they're saying. There will be recovery in syncope. So in cardiac syncope, what will happen? You will know that you will fall. Is it lightheadedness? It's usually, actually, you will not have premonitory symptoms. You will not know you will fall, they are saying. Okay, but otherwise, some people can have lightheadedness, palpitation, chest pain, breathlessness, typical cardiac symptoms. Okay. And in the unconscious period, these people will have extreme death-like pallor. That means they'll be so pale, extreme death-like pallor. That sounds very scary. And they will recover also soon, they are saying. And why does cardiac syncope occur? It can occur because of these arrhythmias. Then what else did we say? They told something, right? Mechanical cardiac dysfunction. Okay. Obstructive cardiomyopathy. So many causes can be there. Coming to neurocardiogenic syncope, these people are definitely going to have the premonitory symptoms, that is nausea, etc. Lightheadedness, sweating they can have. What did you see here? This is vasovagal syncope. These people will, yes, they will be pale. This is because of hypotension. And when they recover, they will, this will be a slow recovery. Okay, but again, they are recovering, right? That's what you should understand. And there will be nausea and lightheadedness. Same thing before and same thing after also. Before, nausea, lightheadedness, then unconscious period, then again recovery, nausea, lightheadedness. Now when it comes to seizures, you should understand here that this recovery will not be so soon, okay, in seizures. That's what they are saying. And there will be something called as aura in seizures. Not all, but yeah, most of them. So they'll have some post-ictal confusion, all those standard things with seizures. No need to bother that much. In this video, we are here to learn about syncope. What do we want to learn, guys? Syncope. Very good. Here they are saying why cardiac causes of impaired cerebral perfusion, arrhythmia, left ventricular dysfunction, aortic stenosis, hypertrophic obstructive cardiomyopathy. So problems with the heart that can lead to cardiac condition that will lead to impaired cerebral perfusion. Okay. Are we missing anything here? Dysfunction over, arrhythmia over, obstructive cardiomyopathy over. One more is there, wait. Arrhythmia, yeah, okay. Everything is there. So this will lead to syncope. That is because of loss of cerebral perfusion. Now let's just look at closing this video. So if somebody has syncope, then what you will do, you will ask the history, etc., what exactly happened and how did they recover and all that. Then you will do ECG, you will monitor blood pressure and all that. And based on this cause, you'll have to treat.